Hi, I'm Chrissy Thomas RN, and welcome to another episode of What to Expect. So in today's episode of What to Expect, we are going to talk about lip injections. And we have our model, Libby. You may recognize her from our Botox episode. And we're going to do some lips on Libby today. Libby's told me that she probably used to have a little bit fuller lip line, but the part of her face that she doesn't like is this lower area here. And so we're going to work on that, and later on in the series I think we're going to do a little bit of other treatment on her, but for today we're going to help restore her lips. And oftentimes with the lips you lose the border that defines the white and the pink part, that separates the white and pink part. So just restoring the border of the lip and then giving a little bit more volume to the pink part or the vermilion of the lip will really turn back the clock and make those lips look more youthful. What I'm going to use today is a newer product from Allergan called Velour. And I really love Velour because it's wonderful to just give the lips a little bit of extra puff. It lasts 18 months, and that's a definite plus. Traditionally, our lip products would last about 6 months. And it doesn't give a real big balloony effect, but just a nice overall sort of puffy lip pocket. So we've been numbing Libby for about 20 minutes now. With a little bit of a lidocaine ointment to get her good and numb, so this will be real comfortable. So are you ready to go?
I'm ready.
We've already taken some before photographs and signed consents. And for the next 24 hours, I'll ask Libby not to take any kind of ibuprofen, aspirin, anything that might thin her blood. It's probably a good idea to wait until tomorrow to exercise or drink alcohol. Just give it 24 hours so we can cut the risk of bruising. So let's get started. All right, so we're getting ready to do our Velour injections for Libby, and I just wanted to point out she's got a little asymmetry, which is common. If you stand very still in the mirror, you're going to see that your lips more than likely are asymmetrical, and it can be just a natural result, or it can be that you've slept on that side for years and it's just made a little bit more of a slant on the side that you sleep on. So Libby's lips, she's a little higher over here, and then she tends to have a little less of the pink showing on this side. So we're going to try to even that up a little bit for her today with our injections. Oh yeah, and I meant to tell you, the way that Juvederm Velour works is that it will draw water to the tissues where it's injected. So the product will first have to warm from our 68 degrees to her 98 degrees, and then it's going to start to draw water in and it's going to fill out the volume. And that's how all of the hyaluronic acid products work that we inject with. Okay, so we finished Libby's lip filler with Velour. I'm going to give her a little ice pack to take home. And keep on there 20 minutes on, 20 minutes off for the evening, just to make sure we don't get any bruising. And we're going to see you back in 2 weeks to see what you think, okay?
Perfect.
What would you say, pain scale of 1 to 10, 10 being the worst?
Really 2 or 3.
Good,
very,
good, good,
very
good.
low.
Yeah, we used a lidocaine numbing cream, so that helps a lot.
Yeah.
Let's take a look.
Oh, wow, cool.
Yeah. Yeah, good, good.
And it doesn't look as wrinkly all around.
Right. So as I said, it's cold and it's very tight in there right now. So as your body warms that product up to 98 degrees, it's then going to soften and just kind of relax a little bit. You're also going to get your feeling back because there is lidocaine in the product that I've injected. So
Okay.
your kind of like this.
Yeah.
And that's going to relax too
Yeah.
whenever the feeling comes back and you have use of your lips again.
Great.
Okay?
I'm excited.
Good, good.
Thank you.
Thanks for joining us for this episode of What to Expect. And don't forget, you can follow us on Instagram, Twitter, and Facebook.